Good day, everyone. First of all, I would like to thank our Professor Wendy Priano for the support and guidance for this Capstone Part 2. I'm Carla May Piligaspi, and my group mates are Christopher, Riza, Diana, and Roj. Today, our group will be presenting on essential intervention to improve healthcare outcomes at North York General Hospital. The implementation of chlorhexidine-based hand scrub to reduce hospital-acquired infection, or HAIs. Hospital-acquired infection remain a significant challenge in healthcare settings worldwide. They not only increase patient morbidity and mortality but also add a significant financial burden to a healthcare system. Our presentation will cover the rationale behind choosing chlorhexidine scrub and the evidence supporting their use, and the implementation plan and the expected outcomes. By the end of this presentation, we hope to demonstrate how this initiative can improve patient safety and reduce healthcare costs, and recreate a culture of excellence in infection prevention at North York General Hospital. Let's start by understanding what hospital-acquired infections are. Hospital-acquired infections are infections that patients acquire during the delivery of healthcare services. They are not present at the time of admission and often result from medical procedures or prolonged hospital stays. In Canada, approximately 220,000 patients are affected by hospital-acquired infections every year, leading to increased rates of morbidity and mortality. These infections also place a significant financial burden on healthcare system, with costs related to extended hospital stays, additional treatments, and even legal repercussions. The good news is that at least 30% of these infections are preventable. These statistics highlight the immense potential for healthcare systems like North York General Hospital to implement targeted interventions and significantly reduce hospital-acquired infection rates.
So why focus on hand hygiene? Hand hygiene is widely recognized as the single most effective way to prevent hospital-acquired infections. Proper hand hygiene disrupts the chain of infection by removing or killing harmful microorganisms before they can spread. Nevertheless, there are still a lot of obstacles to effective hand hygiene. This includes time constraints, lack of proper training, and issues like skin irritation caused by frequent hand washing. This is where chlorhexidine-based hand scrubs offer a significant advantage. Chlorhexidine is a strong antiseptic with broad-spectrum antimicrobial properties. Unlike traditional soap and water, it provides residual antimicrobial action, meaning it continues to kill germs long after its application. This extended protection is particularly valuable in high-risk environments like the intensive care units, where infection transmission rates are high. The evidence supporting chlorhexidine-based hand scrub is compelling. Research, such as the study by Widodo et al. 2020, has shown that chlorhexidine is significantly more effective than traditional soap and water in reducing antimicrobial load. One of chlorhexidine's key advantages is its residual antimicrobial action, which provides ongoing protection long after its application. This feature is especially beneficial in hospital settings where frequent hand washing is required. Moreover, chlorhexidine is a cost-effective solution. By preventing hospital-acquired infections, it reduces the need for expensive treatments and long hospital stays, ultimately saving healthcare systems money while improving patient outcomes.
In Ontario, alcohol-based hand sanitizers are the most common method for hand hygiene, primarily due to their ease of use and effectiveness against most pathogens. Chlorhexidine is typically reserved for high-risk scenarios such as ICU patient care. Additionally, Ontario hospitals emphasize the accessibility of hand hygiene stations and educational programs to ensure compliance. To successfully implement this initiative, we will use Kurt Lewin's change theory, which involves 3 stages: unfreezing, changing, and refreezing. In the unfreezing stage, we will raise awareness among staff about the risks of hospital-acquired infections and the superior efficacy of chlorhexidine. This stage involves addressing any resistance to change by providing clear evidence and emphasizing the benefits of the new protocol. During the changing stage, staff will transition to using chlorhexidine scrubs as the standard practice. This phase requires hands-on training, regular monitoring, and continuous support to ensure a smooth transition. Finally, in the refreezing stage, we will reinforce the new hand hygiene protocol through online audits, feedback, and positive reinforcement. This ensures the change becomes a permanent part of the hospital's infection prevention practices.
So for leadership and sustainability, transformational leadership is crucial for the success of this initiative. By inspiring and motivating the staff, transformational leaders can foster a collaborative and an accountable environment that encourages adherence to the new protocol. To ensure a long-term sustainability, we will integrate chlorhexidine-based hand hygiene practices into staff training programs. Regular audits and update to the protocol will help maintain compliance and address any emerging challenges. Leadership support will be essential in reinforcing the importance of these practices over the time. So for our PICO statement frames, the focus of this initiative. Our populations include intensive care unit healthcare workers at North York General Hospital. The intervention is the implementation of chlorhexidine-based hand scrubs. This is compared to traditional hand washing with soap and water. The desired outcome is 30% reduction in hospital-acquired infections within 6 months.
Our SMART goal for this initiative is as follows. For the specific, implement chlorhexidine-based hand scrub in intensive care unit. For measurable, achieve a 30% reduction in hospital-acquired infections. And for the achievable, this goal is grounded in evidence and includes comprehensive staff training. For the relevant, reducing hospital-acquired infections aligned with the hospital's infections control priorities. And lastly, for the time-bound, the goal is set to be achieved within 6 months. In summary, our project highlights the effectiveness of chlorhexidine-based hand scrubs as a superior alternative to traditional soap and water for preventing hospital-acquired infections. With an evidence-based approach and strong leadership support, we aim to achieve measurable outcomes within 6 months. The next step involving initiating staff training and preparing full-scale implementation. By taking these actions, North York General Hospital Intensive Care Unit can set a benchmark in infection prevention and patient safety.